Good morning. This is Steve Stites, Chief Medical Officer at the University of Kansas Health System. Delighted to be back with you this wonderful Tuesday morning. Dr. Dana Hawkinson, Hawkeye, Doc Hawk, is here with us again this morning. And we are joined by a new guest, another one of our outstanding infectious disease physicians, Wissam El Atrouni. Now, he and I go back a ways because you've heard me talk before about doing cystic fibrosis and having made that a large part of career. And Dr. El Atrouni is one of our two infectious disease experts who really has devoted himself to cystic fibrosis. So I am going to probably tease him without mercy today because he deserves it. Today's topic that we're going to really work on is traveling. Because we've had so many questions that have popped up to us from all of you about traveling. What's safe? What's not safe? Can I make an airplane safe? Where can I go? What can I do? And even Michelle, our interpreter this morning, was just saying, gosh, I want to do a VRBO, whatever that is, out in Florida and drive down, and whether that was okay. And so I think these are all relevant and important questions as we continue to wrestle with life in the COVID era. But as we do that, Doc,
hi.
How are we doing?
We're good. We were up to 11 patients in the hospital. We are back down to 10. We had 10 yesterday. Unfortunately, though, 5 of those are in the ICU or critical care. 2 of those are on the vent. So even though our numbers are lower, we do have a higher proportion needing critical care services. But overall, I think we're happy. We would obviously like to see that number be 0. But it's certainly a lot better than 15, 20, 30 patients in the hospital.
Yeah, or even 40 as we got as high as one time. So that is a lot better overall. Yeah. And I mean, there are times during an influenza epidemic we'll have 20 patients in the hospital with influenza. So really, we are better. Yeah. Yet this isn't influenza. I know people want to draw the correlation because that's something we know and understand. It could have been the 1918 flu or influenza, but it's not really influenza because there is still a much higher death rate with this than influenza.
Absolutely. You know, the full numbers aren't out from this 2019-2020 influenza season, but we think maybe there were 30 to 50,000 deaths from influenza, but probably a lot of those were also from secondary bacterial infection from like staph and strep. Now we are up to, 110,000 deaths from COVID just in the United States alone in 3 months. So just taking a look at those numbers grossly, we can understand that it is much more dangerous to have COVID than influenza.
Yeah, I mean, it's pretty, and that's with society being closed down. I mean, if you think about 100,000 deaths already in 3 months, you could translate that over the year to 200,000, 300,000, 400,000 deaths if things keep going like that. And that could be a struggle, and obviously a lot more deaths than influenza has presented.
Yep.
So, Wissam, tell us a little bit about your science. You've been out on the floors a lot. You've been taking care of patients with COVID-19. How are folks doing? What's your sense of it as another one of our infectious disease colleagues?
Yeah, for sure that we are past the peak of cases here at KU. We used to have up to 40 positive in the hospital, and the ICU used to be filled with those patients. And now moving patients around so they're cohorted in one area in the hospital, the numbers are definitely lower, as Dr. Hawkinson mentioned. I feel the anxiety even among everybody around now. We're kind of get used to this new normal of dealing with those patients and making sure that there's no transmission of infection. So I think we're a much better place. We were talking about ourselves that we think there'll be even less infection maybe in the upcoming influenza season as everybody is hyper cautious about cleanliness and prevention, even things that like C. difficile and others with all the extra hygienes that's happening might be reduced in the hospital.
Yeah, we're pretty hopeful that will be an important difference.
Yeah, absolutely.
I also want to welcome Dr. Danielle Johnson on our show today as we talk about growing our bubbles and how safe that is and the anxiety over that and hitting the road during a pandemic. Dr. Johnson, welcome.
Good morning. How's everyone doing?
We're good. How are you?
I am good. I'm good. I think our biggest struggle is the heat. How do we survive with limited social outings and opportunities when it's 90 degrees outside and we're all stuck in our house or sweating outside? So I think as we continue to deal with some limitations with social activities and outings, we deal with the heat and how do we adjust to not maybe wanting to feel comfortable going to the pool, although I've heard Dr. Hawkinson say the pools are safe. It's just maintaining that space when we're at the pool. So how do we find some creative ways of beating the summer heat while being safe?
So tell us a little bit about some of your patients during the pandemic. What's it been like? What's the level of social anxiety like out there?
I think it's been, for the adults that I see, which I see a handful of adults, that's been difficult mainly because they have children. And so they've been trying to find that balance of doing teaching from home, working from home, keeping their kids entertained, which has been pretty difficult. And the fears of going back out. I have a patient in particular who hasn't gone to the grocery store in a few months and was really scared to go and ultimately did not go to the grocery store because she was nervous about hygiene practices and if everyone else was wearing a mask. And has seen some of her neighbors from a distance, but really is uncomfortable with the idea of the unknown and what if she makes a poor mistake? What if she does have it and doesn't know it and spreads it? With my adolescent and child population, they are sad. They miss their friends. They miss laying on the hammock with their friends. They miss going on bike rides. They miss their peer group. And that's been really difficult, especially for those that are 17, 18 that may be graduating and they've lost out on the typical senior year. And what that was supposed to look like is not how it looks. And although we've had some nice replacements for drive-in ceremonies, it's just not the same. And so dealing with a bit of grief over the expectations of what life should have been for their senior year of high school or college or their freshman year, that things just aren't the same. And so how do we process the loss? And as well as the anxiety of things being so different and not having the normal kind of routine and practices in place. So I think with this level of anxiety that we're all experiencing, there's a bit of grief. We're missing out on what should have been for this last 3 to 4 months.
Well, it's a fascinating, it's a troublesome time in our country as well because we have protests over police brutality, we have COVID-19, and there's just a great sense of loss and anxiety, and that can really affect our mental health, Dr. Johnson. And so, what advice do you have for us to try and help with that? Because there's clearly reasons to have social anxiety, especially I think amongst African Americans.
Yeah. I really think having a place where you feel like you belong, people that you can talk to, making sure you stay connected. So we have this amazing technology, so we have to reach out to the people that we love and care about to find a village. So if you've been involved in any of the protests, to make sure you get some connections there that you guys can stay connected. If you've not been to the protest, but you feel this sense of duty to do something, to find like-minded people. So this is where social technology or social media can be a great asset to reach out to those that have similar or kindred spirits. And that goes beyond, the social struggle that we're having right now. And that goes to just we've all come back together as humans, that we're all in this pandemic together. This is not just one sort of the population that's impacted by this. This is impacting the entire world. So making sure you've got some good social connections. Exercise is unbelievably important. To make sure that we've got some space and time, whether that's 5 minutes to do some meditation or some yoga stretches, or you're going to go out and hit 6 miles tonight. But to make sure you build that in as a daily practice, is setting those routines and practices in place. Because if we don't have a sense of control, everything is that much more overwhelming. So how can we find ways to find some control in our day? Knowing that we can't control everything, we don't have that magic wand, but finding ways in our day that we have control over. So what time you wake up, what you eat for breakfast, having these routines in place, knowing that at 5:30 every night I'm going to go and do 30 minutes of yoga. But that's things to take care of yourself so that you have that control, that you have these known social dates. And so I think a lot of my friends, we've made these ongoing. Every 2 weeks we get together via Zoom or in the driveway and have these connections, but being mindful about it and making sure we make that a priority, because we need to take care of ourselves so we can take care of others.
It's funny. So I always thought that meditation was kind of, I poop on meditation, and I'll be honest. And so then we're in the midst of the COVID crisis, and stress is a little high if you're a hospital person, or if you're a physician or frontline worker, healthcare worker. And I'm sitting at home, and then my daughter said, "Well, Dad, you just need to try a little meditation." I'm like, "Yeah, whatever." And so then I tried it. It's like, darn if it didn't help.
Yeah.
And I sat there, I was like, I got to try this a little bit more. And so now I do my little evening meditation before I go to bed. Oh my gosh, I am more relaxed. I can fall asleep. It's I just have to say, for those of you who maybe like me were doubters, even at age 60 with fading hairlines, you too can meditate and it can actually help you feel better. So we have Jessica Lavelle, who's on the line with us this morning also. You know, we're getting a lot of questions from our community about working from home. You know, people are afraid about spreading the virus, and many businesses, including ours, have encouraged some employees to do that. And even as we start encouraging people to get back because we have to ramp up to take care of all our folks, we still have folks who we want to have stay at home, and you have to work at home. And how do you do that successfully? So Jessica is with psychologist Dr. Greg Nawalanic, who's been on our program before, with some answers about how to handle some of the isolation right there at home. Jess?
Hey, good morning, Dr. Stites, and good morning to you, Dr. Nawalanic. Thanks so much for joining us today. So I'm sure you've been hearing a lot of people having a lot of stress and difficulties and challenges trying to get used to working from home. What are you hearing from people?
People are having to juggle between the two. We've got kids at home, we've got work at home. Structure tends to fall by the wayside. Schedules are out the window. People aren't getting dressed, they're not showering, they're just trying to work from in sweatpants all day, every day. So there's, routine chaos, I think, is kind of what's occurring in a lot of homes, and people are kind of beating themselves up because they don't feel like they're getting it right.
Can we grab a few tips from you as far as how we should tackle this?
Absolutely. I think that that structure and is going to be a great benefit in terms of when we're waking up, when we're going to bed, and this goes for adults and kids. Either way, you're going to see some positive impacts of that. As far as when you're doing work at home, try to have a dedicated workspace where you're going to go to do your work, so it's not like you're doing it in bed. The other piece of this is with your kids. Tag team. If you have two parents at home, one of you gets dedicated work time while the other is attending to the kids, and then swap. So that way there's no sense of an unfair arrangement where one person really gets to do their work and the other one is trying to straddle both worlds.
Dr. Nawalanic, thanks for joining us this morning. We appreciate it.
Of course. Thank you.
Dr. Stites, back to you in the studio.
Thank you. So really, Elizabeth or Danielle, you and Dr. Nawalanic, I think, have just told us the exact same thing. Get us keep some structure, make sure we exercise, and try to be fair in our lives with others. So, wow.
Yes.
All right. So
we're keeping it simple.
And the meditation thing, which again, I actually have to swear by. So let's see if there's any questions from media this morning. But before that, I have one more point to make, which is about mask fashion. This whole thing about yellow, blue, white, different colors. Listen, what does that mean? Why do I care which color my mask is? Because, frankly, I look much better in blue than yellow.
Well, you want to coordinate your colors.
Well, that's what I think.
And,
but it means something. What does it mean? Blue and yellow. The different kinds of masks. I've made him speechless already. See, he wasn't expecting that question, was he?
I wasn't expecting that one. Dr. Hawkinson, I will defer to you.
I think crimson and blue masks are probably the best. However, certainly we know that for surgical masks, we have surgical masks in the hospital, yellow, blue. For the general public, if you're out in public, if you cannot be physically distanced, socially distanced, if you're at a grocery store, if you're in confined spaces, any cloth mask is really going to be good. I don't necessarily have a problem
Well,
with
and I think
color.
the blue masks are the surgical masks, and the yellow have a little different infection control rating.
So the surgical mask, the blue ones from the outside. I know the WHO has a recent statement about the use of masks in public depending on the prevalence of COVID-19 in the community. And they're really making the point that wearing the mask is to protect others. If you're sick, you should be staying home. If you are definitely sick with COVID-19, you want to preferably use a surgical mask if possible over cloth masks. But for the general public, a cloth mask, whatever color it is, should be fine.
Yeah, it does some things. Yes,
and that's a different statement from what Dr. El Atrouni said. You know, the World Health Organization for the longest time didn't really comment on masks for the general public. They wanted to really conserve PPE use for the medical professionals. And now certainly they've kind of reversed that stance a little bit. And we do have better population studies showing that even cloth face masks can protect other people in case you don't know you're sick yet, you're asymptomatic or pre-symptomatic.
There you go. Well, let's first see if there are any questions from media. any. What do we got, Jill?
Donna, she's writing and she says, good morning.
Good morning,
Curious
Donna.
to hear your thoughts about the announcement by the WHO about transmission from people who are asymptomatic.
Oh, this is always
the
a
breaking
concern
news.
about asymptomatic transmission.
Yeah, I
and
love
and
it.
so, gentlemen, what do you think? Dana?
Yeah, so I think as with all of this surrounding COVID, we need to preface this by saying at this point in time. But the other thing is we have to understand that these articles, whether it is the headline or the title of a journal article or whether it's a headline of a news article, we have to read deeper into the story. So if you read deeper into the story, you understand that later on in the interview, she also said, but some people may be what they think is asymptomatic, and we kind of touched on this, but they may actually have mild symptoms or symptoms that are not really consistent with COVID, fevers, cough, chills, shortness of breath, or even loss of smell. So people actually do have symptoms, but they don't understand that they may have mild disease. So that's the important thing to know. What also is important is that we know that your viral loads, the amount of virus that's reproducing in your upper respiratory tract, is probably highest 1 to 2 days prior to any symptoms, and then 1 to 2 days after symptoms start, and from there your viral loads start to go down, again, in your upper respiratory tract. So we're pretty certain you can spread the disease prior to knowing you have symptoms, but I think the thing to take away from this is that people may say they're asymptomatic when actually it's probably just mild disease. We still don't understand the full amount of people that are fully asymptomatic throughout the whole course, but certainly they could be pre-symptomatic or have very mild disease. So that's the important thing to note there.
You know, I remember back in late February, before COVID had really become quite what it is today, or even before the outbreaks in New York had really started, I had gone to Utah with my daughter on a sort of personal thing, and you know, I had this little bit of a cough, and I don't think I had a fever or chill, but I was just a little bit short of breath, and I thought, well, it's the altitude or it's allergies and things like that, and it kind of persisted. It was just a little bit different. And I think to myself, you know, that could have been it. And I would have had really mild symptoms. Today, if I was doing that, man, mask, temperature check, all this stuff, I get a COVID nasal swab. But back then, you know, just a few months ago, right. There wasn't anything for me to do, and it's just odd. I'd love to go get the antibody check once we get it, but don't have that really right yet. And so I wonder if that's asymptomatic spread. So Wissam, I think we have to make sure that people take seriously really mild, well, we're saying asymptomatic, but it could really just be very mild symptoms that are different that they are going to write off as allergies. How do we convince people to say, no, that could be COVID?
Yeah, at this point, we're still in the middle of it. We're not done with the epidemic. So any respiratory symptoms, really, any cough or shortness of breath should be taken seriously. Don't assume this is allergies. I know we're in the spring. We're getting in the summer now, but I think now the threshold for testing is very, very low. And with minimal symptoms, especially if you're in a household with older people, if you're in a household with people with underlying conditions, you want to get tested, you want to isolate yourself if you have any symptoms. I don't want the WHO statement to be a reason to lax all the precautions and to stop wearing masks in public and forget about the social distancing. So that wasn't meant to mean like that. It was more of an epidemiologic statement to say, well, probably the spread from those asymptomatic is not as high as we thought it was before. But we need more studies on this, and this is really preliminary.
Yeah, so here we go. It's going. We always say we're going to be smarter in 2 weeks, and you know what? We are always smarter in 2 weeks. We're just not smart enough.
There's just a lot to learn.
A lot to learn. All right.
Aaliyah is asking, she was sick back in November and December. She did test negative for the flu. Wants to know now, if she got antibody testing, would it be good for personal knowledge and for plasma donation for study?
That's a really great question. And in fact, we may well have had COVID-19 right here in Kansas City, even in November, December, because it was certainly in Wuhan by then. And we have a lot of direct routes, or semi-direct, through one airport. What do you think?
True. Yeah. I think definitely for both purposes, having antibody testing would be helpful. Now, on a personal level, I want to say we don't know yet if being positive means you're protected and you're not going to get infected again. We think it is, as it was mentioned, but until the studies prove that, we're not sure. So even if you test positive, I would say still take the precaution trying to avoid getting infected again, because that's a possibility. Now for plasma donation, yes, the FDA is allowing having a positive antibody test as proof that you had the infection before, and you could contact a blood bank for donation of plasma if you're willing to do that.
And Wissam, you've actually been pretty involved in that plasma donation study here at KU. Talk a little bit about some of the things we're doing and how we've used it.
Yes, so we here at KU are a center for the Expanded Access Program, which is across the nations. The FDA allowed the use of plasma, convalescent plasma, as a treatment for COVID-19, even though we're not sure exactly how effective it is, but there is a historic precedence with using plasma as a treatment for viral infection. This has been used in the past for influenza, even the 1918 Spanish flu. It's been used for Ebola. It's been used for the original SARS, and some with the MERS coronavirus in Saudi Arabia. Even though the studies have not been well controlled, that's why it's not considered established therapy. It's still considered investigational. But this started about 2 months ago in the US, and 20,000 patients have been transfused with convalescent plasma so far across 2,400 centers. So we are one of those centers at KU. You had the community blood center person on the show before.
Indeed.
And they are a collection center, so is the American Red Cross for convalescent plasma. So if we have patients in the hospital and we'd like to treating them with convalescent plasma, we can order that, and we get the plasma from Community Blood Center.
Good deal. What do you think? Is it going to work?
I think by reviewing the literature on this and the data that's available so far that it is effective. I don't have this clean randomized control trial that is controlled to show effectiveness, but this is going to happen. There are randomized trials enrolling patients now, and we have so many patients in the Expanded Access Program, and some of them have not received plasma. So I think that control comparison is going to happen, and I hope and I think it will be effective.
All right. And remdesivir, as we do have that going on now, we're giving quite a bit of that.
Yeah, we have been giving doses to people. Luckily, with the state allocation, the federal allocation plan, we do have still doses available to give, so that's a very good thing. We are using it on our patients that come into the hospital and meet the criteria for it.
So it's pretty clear that people who get COVID-19 are doing better than they did at the beginning of this crisis. Yeah. What things do you guys think are making the difference toward that? Or, A, you have to agree with me first. So you can tell me if you agree with that statement or not. I do think we're better at it. I think it's all about the pulmonologist and the ventilator strategy, but you probably want to take some of the credit.
Right, our lung doctors have been exceptional.
That's what I think
it is.
That's what it is.
You know, it's hard to say. Was it the most vulnerable populations initially that got infected and then got hospitalized and critical illness? If we just look at the meatpacking plants in Kansas and out west, we haven't seen a large increase in surge and overwhelming of those hospital care sites out there from all of those infections. So that's really good to know. That's impressive. And so I don't think we know that for sure. We do understand that there is really no other clinically relevant strain of the virus going around. There's nothing that has been altered. So, we haven't attributed it to that. It may just be that some of the most vulnerable populations have been infected first, especially the nursing homes, and then obviously there were measures taken in those facilities to help reduce the spread, and now we are seeing maybe some more of the healthier, younger patients who are getting infected and not having the complications in the amounts and the propensity that some of the older populations are having.
Yeah, so there you go. All right.
Laura wants you to look into the next 3 months and tell her how safe is traveling on planes.
Okay, here we go. Okay. I've been waiting for this question. Because, so this guy on my left is like a world traveler, and I give him a hard time. He travels all over the world, and he'll post stuff, and I'll say, listen, you can't be doing that. What do you do? You can't go there. It's not safe right now. Oh, I'm going to fly over this different country. I'm going to go a different route. All this stuff this guy does. I know you love to travel all around the world, and you love to get on planes and go do that, but are you traveling by plane right now?
That's a good question. I travel a lot, as Dr. Stites has mentioned, and I've been on planes, I've been sick on planes, so I've been through a lot of situations while traveling. And I've been thinking about how is this going to develop and what is my next plane ride is going to look like. Obviously, the airlines are doing a lot in trying to convince passengers that is safe and that they're doing extra cleaning of their airplanes. There's social distancing at the airport as the airport's starting to open. So I think it is safer now than it used to be before this epidemic. But am I comfortable now being on a flight like this week, next week? I would think, again, if it's not a necessary trip, but I think by taking precautions, if you have a trip, if it's a short trip, I know the planes are not full these days. I've been seeing, I follow some of those travel blogs, and people are traveling are saying the planes are half empty now. So they can definitely kind of separate people on the plane, and at the airport there's this separation. I think if you have to travel, masking on the plane, carry your hand gel with you, keep cleaning your hands, keep the social distancing. I know a lot of the shopping at airports is closed still, so it's not as bad, but if you have control over your travel, we were talking about traveling by car versus traveling by plane, you don't have control of who's going to sit next to you on a plane and what do they have. And if it happens that you sit next to someone who has symptoms, even though they're screening, that's something you don't have control over. So that still is a worry.
You know, I think it's all about your bubble. You know, in the car, I know my bubble. And the car is part of my bubble, right? Because I keep my car clean, and who's been in my car and who's not been in my car, that's my bubble. When I get into an airplane, I don't have control over my bubble anymore. Plus, there's a lot of recirculated air. And I think there's a lot of steps that are being taken on planes to make the air recirculation much safer. I think that's better. But there's also historical data that we know based on other viral illnesses that there is an increased risk of transmission on airplanes, right? Yeah. There is an increased risk. And so what you have to do as a person out in our communities is to try to stay safe. And in order to stay safe, make sure you mask, make sure you wear wash your hands, make sure you do all your hand gel, but man, that mask is important. But Danielle, talk to us a little bit about the anxiety of hitting the road, because there's got to be some anxiety folks have around it, yet they do need to get out of town. So any advice you have for us about that?
Yeah, that's a great point. I think it goes back to this idea of control, what we have control over and what we don't. In our cars, we can sanitize and we know who's in and not in. But as you said, on the airplane, we don't. And so if we decide to travel because it's important to us for social reasons or for work reasons, it's getting the ability to find the things that we have control over. So making sure that we have our hand hygiene, making sure we have our mask, and also accepting that we cannot control the entire situation. So I think a lot of us may struggle with the idea that I have to accept what I can't change. And this is one of those things we're living in. We can't change all these factors, but can I go to the beach and enjoy my time on the beach with my family? Can I go to this work conference that's vitally important that I need to be there and present for? So if we can find some ways to accept by telling ourselves we're doing all that we can to be safe, this is important to me, this brings value and meaning to my life right now, and this trip is what I need for my own mental health, then I can consolidate the worries and the struggles that I may have. Because if I can tell myself this is really important and I'm doing what I can to be safe, just as I'm doing what I can to be safe at home, this is just a different location. And so if we can go into those things, whether that be travel or going to the grocery store, I think we can kind of tackle some of these hurdles more effectively. And we know with exposing ourselves to stressors, the more we expose, the less anxiety-provoking it becomes. So if I don't deal with spiders very well, but I see a small spider and I'm able to be with it, I can kind of graduate up to a bigger spider. If I go ahead and make my travel plans and maybe start out by going to Branson for the weekend, I can build up to this big travel or this big trip.
You bet. You know, and to me, here are the social outings I have. My social outing is either to the grocery store or back. That's the big one. That's really about the only social outing I do. Occasional hardware store thrown in. and to a river. I mean, those are the two things, right? And I figure the river is even safer than the grocery store because there's just nobody around. And I really think that's part of it. And I think, Dr. Johnson, what you just said is so true, and I need to use that line with my wife a little more often. This is important for my own mental health. I need to go to the river. I need to just be outside and be outdoors. And it does make a difference. Meditation is certainly great, but man, the river's even better.
And I think the first thing to note is, where are you going? What is your destination? If you can look up data about that area, whether it's the city or the county. Now, we know there's always caveats with testing. That's been since day one. But get the best data, and sometimes that's going to be available through the state health department. Obviously, New York is going to be different than a cabin in the mountains or on the river. So understanding that. The second biggest piece is to understand and just think of the virus is everywhere. And so there, how do I protect myself moving forward? And that's all the things that we have talked about.
All right, so what's going to happen is that you and I actually both have a trip coming up, Dr. Hawkinson. Talk about where you headed.
I'm traveling. I'll be going to a beach, so was able to understand and look at where I'm going. There's very, very few cases there, but again, that doesn't really mean anything. We understand there's caveats, but can I protect myself moving forward? And how different will that be when I'm there? Will I be eating out at restaurants or bars? Probably not. Again, the most dangerous thing is probably flying in the airplane. How can we protect ourselves in the airport? And on the airplane itself, it's going to be certainly mask, eye protection. Again, we've talked about eye protection, things that you can buy at the hardware store, some stuff that you would buy to protect you if you're working out in the yard or doing something to protect your eyes from doing that. Keeping the mask on properly. Do we need gloves? Probably not. But hand hygiene is definitely going to be important. You can avoid touching high-touch surfaces. You can do frequent hand hygiene, things of that nature. So working and doing that, able to mitigate the risk as much as possible and get to the destination and be healthy and safe there. And once you're there, do the same things you would do at your home or in Kansas City and not deviate from that. Because really the social distancing, once you get to your destination, is going to be very important. If you can continue to social and physically distance, that will be important.
I'm headed down to the Ozarks this weekend for a couple of days, and provided that that tropical storm Cristobal doesn't wipe out all the rivers in the Ozarks, which is actually distinctly possible right now. But headed down to the Ozarks, and then later in a few more weeks I'm going to head out to Colorado and do a little fly fishing. So, but I think you could do those things safely, and being safe is incredibly important. We want to see how you're out there staying safe. So send your photos to medicalnewsnetwork@kmc.edu. Show us pictures of you being safe, and we hope you have a mask on while you do that. So,
and as we move further into this, I'll also be sending pictures and videos, because we know, as you just stated, we have people who want to travel in the summer. We have employees who want to travel in the summer, and there are safe ways to do that. It will never negate the risk, but we can certainly teach you and show you how to mitigate and decrease that risk as much as possible.
All right, Wissam, so where are you going to go?
So for now, I don't have plans for immediate travel. We have our infectious disease meeting in October in Philadelphia, but I'm not sure if that will be an in-person meeting or if it's going to be virtual. So waiting to see. I don't have immediate plans for the summer. But I want to add, because depending on the states you're in, some states have rules about if coming out of states with quarantine still. So do check your destination state and what the state rules are.
And also check the KDHE rules, because they're going to have a little different take on some of that as well. So
okay, so this is building into a good discussion. Sean, he writes in. He's got family here in a bubble, family in another state in a bubble, and family in a third state, which has got grandma, so older people. Can they all get together at one person's bubble, and what are the rules when you get there?
Oh boy, this is always a hard question to keep everybody safe. Okay, so everybody on our panel this morning is going to have a part in this answer. I sort of have that thing going on right now. My daughter just came back from Chicago, and she's been in a bubble there, done a good job staying in a bubble. We have a bubble here, my family in Kansas City. My wife's sister has a bubble. They live in the south part of Kansas City, and her son just came home as well. So, boy, there's like 4 bubbles there, and within that bubble is an 87-year-old. My wife's mom is 87 years old, and she's in a bubble. So we're trying to figure out what do we do to keep everybody safe here? Should I just make people get tested if they're from Chicago? Should I make sure everybody wears a mask? How do we maintain social distance? Okay, ID experts, let's go. Wissam, you're up first.
All right, so I would worry about the elderly and those with health conditions. I don't think it's a no. I've been asked that same question by a patient on our last telehealth visits. I think now as the numbers are going down, again, are we coming from a hotspot area or not? So, because that could be a no if someone is living or has been in a high-risk exposure area. Otherwise, let's say everybody's been doing really well in their own bubbles, and they're not in a high prevalence or transmission area, then I think it's okay to reunite. I would make extra precautions about the elderly and those with health conditions, about keeping that social distancing even in the house, and try not to get too close to them.
Yeah, I think that, again, understanding who is coming in, what is their bubble, have they been safe? And we talked about, there are cases that are continuing to go up every year, every day in the nation. So we know that cases are increasing. So understand where those bubbles are coming from. Understand also, and then we haven't really addressed this, but there is a little bit of data. There is a couple publications that show even mask wearing in the family household reduces transmission as well. Again, we haven't really focused on that and addressed it because it's hard to do on a daily basis in your household. So even mask wearing could possibly be an option, especially if you are in a confined space. Otherwise, if you can try and be outdoors as much as possible doing things, cleaning high-touch surfaces, continuing to do hand hygiene, avoiding touching your hands and face. And again, if you can avoid going out to restaurants and doing those things, that will help all the more.
Elizabeth, how do we handle the anxiety around this question? Elizabeth, sorry. Danielle, how do we handle the anxiety around this question? Because I think that people will have a lot of anxiety and will have some confusion about it. We certainly heard it in this listener's voice. Thoughts?
Yeah, that is a difficult area. I think we all face how do we manage our family relationships and friend relationships safely. And I think even for my own family, we've made decisions to keep our kids isolated for health reasons and making sure that we've got everything kind of tight-knit, which provokes anxiety because, again, it goes back to that idea of control. I need to have, 100% control of my environment, which is not reasonable. So I always tell my patients, we've got to lower the bar. We've got to lower the bar of expectations. As long as I can hit these baseline metrics of hygiene practices, hand hygiene, wearing a mask when I leave my house, doing the practices I know that I can reasonably do, then that's all I can do to kind of lower some of that anxiety. Being creative with having some outings. And so going outside and making these bubbled dates with family that maybe you, because they're elderly or they have health issues or you want to just maintain your own bubble, setting up tables outside that you all can stay socially distanced, yet be together, still talk, still have food, finding those creative ways to get together outside since it's now warm enough to be outside without fear of rain. Telling yourself that you are doing the best you can. I think, again, this bar being so high that we have to do everything perfectly right provokes anxiety, and that's pre-COVID. For those that are perfectionistic by nature, that bar is so high that they must always hit. That creates anxiety. And so if we can lower that bar to let ourselves know, am I doing the basic things I need to do? Then yes. Am I taking care of my family the best I can and myself the best I can? Then yes. And so then what can I do to have fun? If I am more rigid with following these rules, I need to find some ways to have fun that meet that guideline. If I'm more loose, because some people have been more loose, how do I safely have a good time and relax myself while still being safe? And so being able to find some ways to know that I'm being safe, know that I'm still enjoying life, because when we get so anxious, nothing's enjoyable because everything's fear-provoking or anxiety-provoking. So finding those ways to make sure that we exercise, meditate on a regular basis, that we do engage in exercise, that we do say, I'm going to have this time with my family where we can just kind of be in the moment. And so if we can actually be in the moment, really take it in, have these really good conversations, that will reduce the anxiety that we're experiencing. And it's finding that personal to you, because what works for me may not work for you. So going for a run will not work for everyone, but doing an hour of yoga will work for some people, will not work for others, or going for a long bike ride. But finding those things that you know fully fill your tank and doing those on a regular basis. And by regular, I mean like every single day, maybe modified for time, but every day doing those practices that we know recenter us and keep us in a good headspace and keeping our anxiety in check. So you need to journal to kind of do a rating of where I'm at. I feel my heart rate's elevated right now. I'm kind of sweaty. I'm feeling panicked. Let's go back and figure out what's kind of building into that.
You know, Danielle, that's great advice. And great advice. And so that, we've talked on this show before about how life is a balance, to your point, Danielle. And I think that people sometimes get frustrated because they want a yes or no answer. Is it safe to bring 3 families together in one central location and to be together in one bubble? I just want to know, is it safe or not? Mm-hmm. And the answer is, well, maybe. And the hesitation is, A, what's your tolerance of risk? Are you willing to have a little more risk? Because is it as safe as staying in your own bubble right in your own home? No, it is not. And there's nothing you can do that's going to make it as safe as that. Is it safe enough for you on a personal level, and are you willing to accept the consequences? That's a personal decision. And we can't tell you how to make that personal decision. We can just give you the best possible advice for trying to stay safe. I think you've heard it today. It's all about how you conduct yourself in order to minimize the risk. But when you travel, will you be as safe as you are in your own home? Nope. Is it safe enough for your personal risk, and are you willing to take that equation and run with it? I am, and others are. What you have to do is just to make that personal decision, and along the way, follow the example that Dr. Johnson is setting for us through exercise, meditation, and things of that nature to try and keep ourselves healthy. Jill, I think we have time for one more question. I know we have a lot, but there's great questions out there.
Okay, I'm going to give you 2 really quick, and then the one that's a little bit longer. Stephanie wants to know, are you really flying? Do you feel safe, and will we hear from you?
All right, Dana Hawkinson, will we hear you from you, Dr.
Absolutely. There's a little bit of concern, obviously. Again, I think we have tried to promote healthy and risk reduction strategies. I'm going to be following those risk reduction strategies. The most risky probably is going to be in the plane itself. I think we can avoid a lot of the risk in the airport itself, just as being in a grocery store. But certainly we'll be doing mask, eye protection, hand sanitizer, all of that stuff. And I think doing that, and by that way, we'll certainly be able to mitigate the risk as much as possible.
So are we going to hear from you, Hawkeye, while you're doing some of these travels?
I will be doing some healthy education videos and pictures, and really trying to promote other ways that other people can be safe as they continue to move out in the summer and travel, should they choose to do so.
So that's going to be one way we'll be staying in touch with Hawkeye, even while he travels, and we'll get a real experience. And don't encourage Dr. El Atrouni to get back on a plane too much, though, because we know first thing he's going to do, he's going to jump and fly somewhere.
He does like to go across the oceans.
He does like to go across the pond. And so what do you think? Are you comfortable with his traveling by plane?
I think that's a good start. If I want to start traveling, I'll probably do it locally and shorter flights, less than 4 hours kind of flights. I'm not planning any international trips now. The quarantine rules makes me a little bit nervous with international travels, because you might have a second wave in a country and be stuck and not able to come back, or you might be quarantined when you come back. So that makes me kind of pause. But local flights, I would be more willing to,
Yeah, there you go.
Holly has international travel planned. She's asking about children. She doesn't say the age. How do you keep them safe?
Okay.
Would you do it?
Yeah.
Well, so what do you think? Traveling internationally with kids.
Yeah, okay. So I don't have children, but Dr. Hawkinson, maybe you'll have more experience with that, traveling with children. I think the rules are the same for children and adults. I know there's an age where the masks are not recommended, but really the hand hygiene would be the things to stress, and having control over the environment as much as you can, knowing where your kids are, what are they doing at all time. But I would say the rules are going to be the same. If it's a must-travel international situation, then following the same recommendations would be what I would say.
And Dana, this thing about kids, they may not be the vectors we thought they were anyway. They don't get as sick when they get, by and large. They can get really sick, but by and large they don't get as sick with the COVID-19. And B, they may not be spreading it to others like we thought originally.
Yeah, we don't think they can spread it, again, based on indirect evidence, looking at secondary contacts. As easily as adults can spread it, they still can spread it. Obviously, if you are going to be in close proximity with them in a hotel room, in a VRBO, in an apartment or something like that, there's still that possibility that they can still get infected. And we understand, and we've talked about this, it's more difficult for them to physically distance. It's more difficult to them to do adequate hand hygiene. They are probably too young to do face masks. Even if they are of age to do a face mask, they're probably going to be manipulating and touching themselves in their eyes, their nose, or mouth anyway. So it is a little bit more risky, certainly, than an adult would be.
And final question. Robin says, how do we encourage people to get tested when presumed positive or asymptomatic means loss of work?
All right, boy,
Yeah,
that's a really
that's a
hard
great
question.
question.
Okay, how do we get people to be tested if you become positive and loss of work? So this is a philosophical question more than a medical question. And Danielle, I'm going to turn to you here in just a moment about this. When we're in a workplace, we owe it not only to ourselves but to everybody around us to keep others healthy. If you're positive, it means you may be having other people at risk because of your being positive and spreading it. Now, I recognize that could hurt you at work, and that's hard. And every company treats this a little differently. I mean, okay, we have our own policy. If you're positive here while you work and we get tested positive, we're going to keep you whole while you're off. But not everybody does that, and so I know there's got to be a lot of fear and anxiety. What I would urge you to do is to remember that COVID-19 is not influenza, and that if, like going to work when you're sick, if you make someone else ill, or they get SARS-CoV-2 and then they take it home to a loved one or an immunocompromised or older person like me, then you could be responsible for somebody else perhaps not surviving that illness. To me, that's the balance. That's the social equation we all have to follow right now. And social equations like that are hard. They're hard because you don't want to lose your job. But you don't want to be the cause of somebody losing their life. There are times when social justice has to overcome our personal needs. And I think that's one of them. Danielle?
Completely agree. That is a hard question. I think for those that have less financial means, the idea of not working means not being paid. And then how do you deal with that consequence for your own immediate family, and which may make it harder to think about the society as a whole. I think in the States we are quite the individualistic society versus other countries in which it's more collectivistic, in which they've also seen their numbers, I think, dive much deeper or dive much lower, much quicker, just because there's a sense of community in that I take care of my brother, and that we're all brothers, and so we take care of each other. And the struggle here is that there's such a disproportionate impact of COVID. I think I've heard everyone mention how the disproportionate impact from Wyandotte to Johnson County, and I have psychology interns that ask the question about, well, why is Johnson County's number is so low and Wyandotte County is so high? And you think about the social status of the two counties, given that people in Johnson County are more likely to be able to work from home versus Wyandotte County. And so we've got these kind of inherent barriers to how we address this issue. And so, again, I wish I had this really black and white answer to that question. I would say we all should take care of each other. We all should be at home. There is this real impact, though. If I can't pay for my housing, I can't pay for my children need, then who is there to support me? So that is such a difficult question, and I wish we had more support systems in place to really address this, because if we did, we would see our numbers, I think, drop tremendously, because we could all truly be home for a few months and really wipe this out. But that's not the reality of the situation. So being able to utilize resources and support. So even if you are testing positive, you have less financial resources, I think we as a society then need to step up and say, here's some resources. I think the media has been really good with listing some resources for social services, but making it quite clear, we want you to stay home because that's what we all need for you to do for your health and for our health. And here are some resources that you can utilize. And so being able to dial, I think it's 311 398 WAY is a resource. Going to your local health department is a resource. calling your doctor to say, hey, do you know of anything? Is there a social worker there that can kind of key me in? So being able to then say you are positive, comma, here are some resources that will help in this process if you need financial or housing or food resources. So I think although as a healthcare system, our job isn't to provide these other resources, if in the system we had some options of you are testing positive, do you have financial concerns? Do you have food concerns? And if so, here are some local resources that may be of help to you so that you can be at home safely, taking care of yourself and taking care of the rest of us by being home.
I think that's exactly right. Absolutely. So, Dana, you or Dr. El Atrouni, final thoughts? Wissam?
So again, I want to mention that this comparison with influenza always comes up. In my mind, I would put the regular common cold coronaviruses as the low pathogenicity, low impact pathogens. I would put influenza in the middle as medium pathogenicity, high impact on the community. And this new coronavirus is high pathogenicity and high impact. So definitely more severe, and we have to treat it as such.
Yeah, thank you. Okay, Hawkeye.
Yeah.
You got to be safe out there now.
Again, I think it's important. I'm glad and I'm happy that the World Health Organization has now come out and said that, face masks will help. And the thing that we want to do is reduce transmission. And we know that even Dr. Fauci had said, I wouldn't wear a face mask if I'm ill. But unfortunately with this, you don't always understand if you're ill or have the infection because of that pre-symptomatic phase, because of those other populations that may be asymptomatic or have mild symptoms. So it's going to be important as we move forward. And again, I think this was a good thing in the demonstrations and the protests. A lot of them were wearing masks. Although not physically distanced, they were wearing masks. We know that wearing masks can help. We've seen that in the small studies and the exposures of the hairstylists and their clients. So continue to wear your mask, continue to do hand hygiene frequently and appropriately, and really it comes down to continued personal responsibility and reducing the risk of spread as much as possible.
Yeah, and in that example of the hair salon, I believe that no one has been developed SARS-CoV-2 or COVID-19. So tomorrow morning, just as a brief update, Dr. Jeff Burns, co-director of the KU Alzheimer's Disease Center, and psychologist Elizabeth Mex will be returning to the program to join us to talk about social isolation, loneliness, and especially how does that affect the elderly and those who may suffer from some cognitive issues and some loss. These are hard questions. Gosh, they're hard questions, right? There's just a lot of issues out there. In many ways, the questions about COVID-19 really are questions about social justice. How do we treat each other? How do we make sure we take care of each other? I'm reminded of a lesson I used to try to teach my kids. The first three words are we the people. They're not I the one. Mm-hmm. We the people are in this together, and we're in many things together. And how we treat each other and how we take care of each other really define us by our actions and our deeds. We the people get to determine issues around social justice, and we the people have the ability to change those things. And in healthcare, it takes all of us to keep each of us safe. All of us to keep each of us safe. Till tomorrow, we'll see you, and remember, there's still no place like home. Thank you.